Well, I've been in the natural healing field since 1949. I started studying then. I've been in continuous practice for the last 45 years as a chiropractic physician, a naturopathic physician, clinical nutritionist, an acupuncturist, and so on. So I have kind of a broad practice. I'm predominantly a chiropractor, and throughout the years, people come to me because they have pain. And they don't come to me because they have crooked back like they go to an orthodontist because they have crooked teeth. They come because they have pain. And so in relieving pain, you use whatever modalities you can. And in any inflammatory condition, which we're dealing with primarily when there's pain, you have heat, swelling, and pain. That's what inflammation is. So I found that the Warp 10 has been a great modality for me to use. It's portable, it's handheld, it's inexpensive. It's the most inexpensive piece of physical therapy I've ever used, and it's made in the United States. So if you need it repaired, you get it repaired in the United States. So that's a big important point. I've been involved with using this for the last 6 months, and I've gotten probably a dozen other chiropractors involved in using this, and they were all have stated that for their own benefit, most of them bought it because they had a problem, a knee problem, a shoulder problem, and they wanted to get rid of the pain, and what modalities they had wasn't working. So basically, I found that people, if you get rid of their pain, then you're a good doctor. If you don't, then you're just going after their money. So the faster you get rid of the pain, the faster they feel better, the better you look in their eyes, and the more people they refer to you. So since I've had this, I've had a lot more referrals. Instead of retiring, I'm working more. Oh, that's not too bad. I was very impressed with the quality and the research that's been done, and the fact that there could be quick results. And so it was just by chance. And I thank God every day that I found this because I've been able to help other people and I've been able to help myself. Now I'll tell you just something about this, because I have a dislocated vertebra in my neck that's unrepairable. The ligaments were torn in a severe accident. And so as a consequence, the only way to stabilize that is to increase the production of collagen. And the ligaments are made up of collagen, the discs are collagen. So I've been using this on my neck. I just put it up here, I turn it on. In fact, I just had an adjustment, so to reduce the inflammation, I'll hold this on here. It'll just be on here for 80 seconds. It's automatic, it goes off in 80 seconds. You can repeat it twice and twice a day. So I've been using it on my spine, my neck, and my lower back, and it's cut down the number of adjustments I need, so it's beginning to stabilize my spine. Now the key thing in chiropractic is when a patient comes to us and they've had an injury to their spine, there's been micro trauma to the ligaments. And as a consequence of that, the ligaments lose their elasticity, meaning they're not as flexible. When we bend and twist and so on in the spine, those ligaments have what I call yellow elastic tissue. And when you have an injury, what happens is the body repairs it by putting white inelastic tissue. So I'm finding that I have more flexibility now, so the warp must be encouraging the growth of yellow elastic tissue in this injured area. Now see, this is still going here, I'll keep it on there. And because it's handheld and it's portable, I can hand it to a patient and have them use it on the area. I usually do it 2 or 3 times so they don't stop doing it in the middle of the treatment, you know. I said, it'll go off, there's no bells ringing, it'll go off, you'll know. And the other thing that happened to me this last June, I got Lyme's disease. Lyme's disease is pretty rampant, and you can have swelling in your joints like rheumatoid arthritis. So I had a bit of the rheumatoid arthritis in these joints, and it still was bothering me. I mean, I've conquered the Lyme's disease. So I started using this over these knuckles, and now I have no residual pain at all. So it cleared up that inflammation, see. So I benefited, see, from this. I had one patient, her husband, who was limping when she walked in with him, and I said, "What's the matter?" He said, "Well, I got plantar fasciitis." I said, "Well, take your shoe off." And I said, "Take your sock off too." And I handed this to him. I said, push this button, turn the light on. And I said, then repeat it when it goes off. Wait till this light goes off. Push it again. He did that. He got up and walked around. He said, "I don't have any pain." I said, "Isn't that marvelous?" He said, "How much does one of those cost?" I said, "Well, you may not need to buy one. Maybe one more treatment. We'll see. Next time you come in." A week later he came in. He says, "It's just a little painful. Can I do it again?" I said, "Sure." You know, and so, but with everyone that I've used this on, they've been very receptive, you know, and they never asked me any questions about, you know, is it going to be harmful or anything. I just assure them. I said, "There's no harm. This is light." I said, "This is light, and the light penetrates into the tissues and enhances the function of the cells, reduces inflammation. It increases, I don't explain it to them this thoroughly. I said it increases the amount of blood flowing to the area and away from the area, which is what reduces edema. It increases the amount of lymph fluid that's flowing away because it dilates the lymph vessels twice their normal size, and that's what you have to reduce edema or swelling. And so the other thing that I will say to some people, there's some people aren't interested, but I'll say, well, you know, it'll increase the amount of ATP. It is adenosine triphosphate. I said, that's the secret to increasing energy in the cell, and that happens in the mitochondria. The mitochondria are the powerhouses of the cell. That's where our energy is created to run our whole system. And I'll explain to them sometimes. I'll say, well, you know, a cell contains a lot of different components. It has a nucleus, and it has different Golgi bodies and organelles, but I said the biggest one is the mitochondria. And there are sufficient mitochondria to occupy 25% of the cytoplasm, or the inside of the cell. And so if you can activate the mitochondria, then you've enhanced the function of that cell. Now, if a cell is damaged, there's still some functioning mitochondria. And so the more you activate that mitochondria, the faster the healing occurs. And on and on. See, there's... So you get down to the intricacy of what's really happened at the cellular level, or even down to the atomic level. And you know, the word quanta means a package of energy, or a photon. And that's what we receive from the sun, a photon energy. And this is in a spectrum where it doesn't heat. There's no heat involved. So it's not like you're putting the infrared in the spectrum where you'll feel heat. When we're out in the sunlight, what we feel is infrared, but this is the longer wavelength. The longer the wavelength, the deeper the penetration. The deeper the penetration, the greater the healing. I'm getting reports back from other chiropractors that I've gotten interested. They're finding they can treat shoulder problems, hip problems. Well, really, the reality of it all is this. You know, it doesn't take much to be a good diagnostician. You have to name the part, and then you add ITIS on the end of that part, and then you have the name of the condition. See, whether it's a bursitis, you know, tendinitis, you know, tennis elbow, carpal tunnel syndrome. Use this right over the wrist. Reduce the swelling in that carpal tunnel, you know, and then the person won't have the tingling in their hands. Inflammation is the thing that alerts us that there's something wrong. Our body will increase the temperature of the tissue to bring more blood in and to bring more nutrients to repair that, more white blood cells, bring more oxygen in. That's the other thing. This increases oxygenation of the hemoglobin. So the hemoglobin takes up more oxygen. And so without oxygen, tissues can't be repaired. And without nutrients, it can't be repaired. So it's very fundamental. Just increase the circulation to and away, and increase the flow of the waste products away, increase the activity of the white blood cells that gobble up the waste products. This is called phagocytosis, and then you have repair. I do acupuncture on the acupuncture point related to the tissues that are involved. Then I use the warp tin on there, and I find that I don't have to repeat the acupuncture as much as I would without it. So it's activating things in the cells. It's opening the flow of what's called chi energy, which flows through a system that's different than the nervous system. They're called meridians of the body. This has been accepted here in the United States. I became a certified acupuncturist in 1976, shortly after it was introduced to this country, and I've used it for a lot of different things, and so I'm finding this work. Another thing that I have found exciting is that I thought, all right, now we have certain systems that may be sluggish, particularly the immune system. So what I do the first thing in the morning, I put this right over my thymus gland, which is the key gland in the immune system. Now, the thymus gland, when a white blood cell goes through the thymus gland, it's called a T cell, because it's gone through. Now, the T cell has the capacity to destroy 100 times its size in viruses, bacteria, any invasion, fungus, parasites, and it will still function. It kind of reminds me of Mr. T, you know, the guy that wore the chains, you know, and you think, boy, those T cells, I want to activate those. So I found the first thing I do in the morning, put that over my thymus. That prepares me for the day. I go out, people are coming down with the flu, I don't get it. I've activated my main immune gland, see. The other thing too is the liver and the spleen are involved with the immune system. So I'll put it over my liver and I'll put it over my spleen. So why not activate those? Now this is something I didn't find in the literature.
You're just doing it on your own.
I'm doing this on my own.
Right, you're kind of
but I'm finding that it's working, see? And I'm finding it's working with the patients that I'm using it on.
And you're drawing the conclusion of that rejuvenation of these areas.
Well, actually, activating it. An old sluggish cell has to be, you know, activated. Yeah, okay. See? And what you're doing is you're actually getting right down to the mitochondria in those cells. And then the magic starts from there. I believe that we have just barely scraped the surface on quantum physics and understanding all there is to know about it. But that's the future, is getting and applying the knowledge that we have now. Maybe, I'll tell patients, some patients will say, well, how do you know that works? I said, well, we'll just try it. I said, well, explain to me how your cell phone works. They said, well, I don't know. I said, you use it, don't you? Well, yeah, I use it all the time. I said, well, a lot of things we use that we don't understand how they work, but if you're really interested, you'll delve into it. But you don't have enough time in your lifetime to know all the intricacies of all the things that we use are time-saving devices, you know.